Good afternoon, everybody, and welcome to the webinar Incorporating Developmental Monitoring into Early Childhood Programs, Celebrating Milestones and Identifying Concerns. We'll wait a few minutes just to allow other people to join, so thank you for joining us, and we'll be with you shortly. So good afternoon, everyone, and I'd like to welcome you to today's webinar, Incorporating Developmental Monitoring into Early Childhood Programs, Celebrating Milestones and Identifying Concerns. My name is Evelyn Blank, and I am the Director of the New York City Early Childhood Mental Health Training and Technical Assistance Center, otherwise known as TTAC, and I'm joined today by Dr. Romina Barros, who I will introduce shortly. And I did want to let people know that this is part 2 of a 2-part series. And for those who may have missed the original one or would like to go back and review it, the original webinar is posted on the TTAC website, which is ttacny.org. And very shortly, you will see a link to that. So just a few logistics to let you know that today's webinar is being recorded, and both the slide deck as well as the actual webinar will be posted on our website in a few days. We'll also be taking questions throughout the webinar today, and we will answer these at the end, so that if people want to chat in any questions into the chat box, we will answer and respond to them at the end. And if we don't have the opportunity to respond to them live today, we will certainly try and get back to everyone. So welcome, and I just wanted to let you know a little bit about who we are. And the New York Center for Child Development, we've been a major provider of early childhood mental health services, both through federal, state, city, philanthropically funded programs in New York. And we also have a long history of providing system-level expertise to inform policy, but also to support the field of early childhood mental health through training and direct practice. And we're very privileged in this grant to be partnering with NYU McSilver Institute for Poverty Policy and Research, who offer clinic, business, and system transformation support statewide to all behavioral health providers. And this partnership is funded through the Thrive New York City in partnership with the New York City Department of Health and Mental Hygiene. And we've been very excited to be able to offer ongoing learning opportunities, both live in person and also through webinars. And I would encourage everybody to join our learning community. You have our website below here, ttacny.org. And also encourage people to join our listserv. So go to our website, click on Contact Us, and let us know that you'd like to be part of our listserv here to know about upcoming opportunities. So it is now my privilege to introduce Dr. Romina Barros, who is a developmental and behavioral pediatrician. She currently serves as the medical director of trauma services for children under 5 and also group attachment-based intervention, which is otherwise known as GABI. And both of these are housed at the Rose F. Kennedy Children's Evaluation and Rehabilitation Center at Montefiore Medical Center. She currently maintains a faculty appointment as an assistant professor of pediatrics at Einstein Medical Center and was recently selected as the CDC Act Early Ambassador for New York State. And it's in this capacity that she is providing these webinars. So thank you, and please join me in welcoming Dr. Barros.
Hi, good afternoon, everyone. Thank you so much for the lovely presentation, Evelyn. And it's a pleasure for me to be here today providing this webinar. And for those of you who participated in the previous webinar, welcome back. So today, what we will be talking about is following up what we discussed on the first webinar with regards to child development. We're going to talk about why monitoring children's development is important, why you have a unique and important role in developmental monitoring, why identifying children with developmental delays early is so important, what does developmental monitoring mean, understanding the differences between developmental monitoring, screening, and assessment, how to talk with parents about their child's development, especially when you have to have that hard conversation that you may be concerned about their child's development, and learn how to use the CDC Learn the Science Act early resources in early childhood programs. So your important role in monitoring child's development. 1 in 6 children. Developmental disabilities are surprisingly common. If you have not already had a child in your care with a developmental delay or a disability, chances are that you will. The Center for Disease Control and Prevention estimates that about 1 in 6 children has a developmental disability, which approximately means 17% of children between the age of 3 through 17 have 1 or more developmental disabilities. Why early identification is so important. And I know everybody likes to hear about numbers and percentage. If we look at these numbers, nearly 25% of young children in the U.S. are at risk for developmental delay. But what is more concerning to me is that more than 80% of children with a developmental delay don't receive the needed services until after the age of 3. We all know that early intervention programs effectively improve developmental skills and help children at risk of developmental disabilities or delays thrive socially as well as academically. But as we can see from what research is telling us and what these numbers are telling us, unfortunately, only a small portion of children who could benefit from early intervention are identified early enough to receive it. And if we look further up into the age of children, research tells us that only about 1/2 of children with developmental problems are identified before the school entrance. Why monitoring child development is so important? I think the most important reason for monitoring each child's development is to find out if a child's development is on track. It is important to act early if there are signs of potential developmental delays, because we know that early treatment is so important for improving a child's skills and abilities. Early treatment is important because early treatment can make a big difference in child's ability to learn new skills. Developmental disabilities increase a child's risk for poor school performance, frequent absences from school, and repeating a grade. Speech therapy, physical therapy, and other services are available in every state for free or at a very low cost to parents. But if a developmental concern is not identified early, as we were saying before, parents cannot really take the advantage of these services. So what is your role? The first years of life are so important for the child's development. As we talked during the first webinar, we know that the brain connections and the brain development happens during the first 3 years of life. And it's so important for the child to have the stimulation that it needs for those connections to happen. So we know that early experience make a difference in how young children's brains development and influence lifelong learning and health. So as an early child care health provider, you have a unique opportunity to empower the families you serve to help their children achieve their full potential. It is important to keep in mind that it's never your role to make or suggest any diagnosis for the child. And using monitoring checklists to monitor child development, it's not for you to give a diagnosis. It's for you to look for and note a child's development, to share what you have seen with the parents and to encourage the parents to talk to their child's doctor if you or they have any concerns about their child development. Monitoring each child's development is easy if we have the right tools and the right resources. And this is what I'm hoping that you will get at the end of this presentation. The Center for Disease Control and Prevention, the CDC, offers free, easy-to-use tools to help you look for and track developmental milestones. Milestone checklists are not validated screening tools, and we're going to learn later in this lecture what's the difference between monitoring, screening, and assessment. And they're not intend to be used to diagnose any developmental disability. Our intent to help you and help the parents track the child's development and look for further assessment if there is any concerns. So let's talk a little bit about what is developmental monitoring. So developmental monitoring is a series of activities in partnership with the parents and caregivers of children birth to age. And this includes promoting typical development through regular check-in conversations with parents, through the use of developmental checklists, and also the detection of developmental concerns. Developmental monitoring is an ongoing and flexible process. Ongoing means that you're going to start when the child is 2 months, and you can use monitoring until the child turns 5. And it's flexible because you can choose whenever you want to do the monitoring. You can do monitoring of developmental milestones every 3 months, every month, depends on, what type of program you have and how often, you do check-ins with the families. And ensures that all children who need support get the access to developmental screening and support as soon as possible. So what's the difference between developmental monitoring and developmental screening, and why developmental monitoring is so important? The American Academy of Pediatrics came with guidelines more than 10 years ago in 2006. Being all those numbers, all the statistics that we have discussed today on how prevalent developmental disabilities are and how we're not really being able to pick up those children at an early age and give them the opportunity to receive services. So the American Academy of Pediatrics came with these guidelines in 2006 for all pediatricians to use developmental screening. And they came with the guidelines on when the recommendations of the developmental screening should be done. However, even that has been put in place, we still have a lot of children that we miss. We still have a lot of children that don't get the appropriate diagnosis and the appropriate services until they get into school. So that's why the CDC, together with the American Academy of Pediatrics, started launching this campaign, Learn the Signs, Act Early, to promote all educators and providers, early childhood educators and early childhood providers, to empower parents to learn about development. And they created this developmental monitoring. So developmental monitoring, can be done by parents, can be done by teachers, and can also be done by health professionals. It's an ongoing process, as we said before, and you have the tools to do that. For example, one of the websites that you can use to access these free resources is the CDC. What is developmental screening? Developmental screening is a formal process. It has to be done by health professionals. It can be done by teachers, but they need a special training. It's a formal process because it's done by using a validated screening tool. That means a tool that has been standardized for screening. And there's many out there. One of the most common ones used is the Ages and Stages questionnaires. The American Academy of Pediatrics recommends that formal screenings should be done at the age of 9, 18, 24, and 30 months. So what are the things that developmental monitoring and developmental screenings have together? They both look for developmental milestones, and they both are important for tracking signs of development and identifying concerns. Monitoring gives, early childhood teachers and providers or care to be able to use it with more flexibility. With screenings, you need to get trained for that, and you need to use a validated screening tool. When you do a developmental screening, even though it's a formal process, you're still, when you use a screening tool, you're still not using those screening tools to give a diagnosis. It's a formal process that comes after monitoring that it's done by the pediatrician. So the pediatrician then can decide what is the next best step for that family in terms of follow-up. Okay, benefits of developmental monitoring. Developmental monitoring gives you the opportunity for a meaningful discussion with the families, support the parents to learn about developmental milestones. We're empowering the parents to learn about child development. We have empowered parents to learn about immunizations, to make decisions about immunizations. We empower parents with all this medical information. Now we want to empower the parents also with understanding developmental milestones, and we're going to give them the tools to do that, to engage parents in actively monitoring their child's development, to encourage parents to play with their children, to help us know if children are developing on track. They also provide parents an opportunity to voice concerns about development and choose the course of action, and also helps identify developmental delays as early as possible. So this is the warning. We talk a little bit about that. Even though developmental monitoring and checklists are very, very helpful, they have very important limitations. Remember, Milestones checklists are not validated screening tools. The American Academy of Pediatrics, we say before, recommend that all children receive a formal screening using a validated tool at the age of 9, 18, 24, and 30 months, which is not a developmental checklist. Milestone checklist cannot be used to diagnose any developmental disability, and diagnosis a child with a developmental disability often requires an in-depth evaluation by one or more specialists. Okay, how to use the CDC tools for developmental monitoring. So we have a picture here of how a checklist, a developmental checklist looks like from the CDC website. This had been created in conjunction with the American Academy of Pediatrics to make your work easier, and also, to help the parents become better partners in monitoring development, the development of their children. So this is how it looks like. If you look at the picture here, this is a developmental checklist for a 9-month-old baby. It's divided by the different domains, as we discussed at the last webinar, with social, emotional, language communication, cognitive and movement, physical development. And then also on, the same page, we have what are the warning signs, what are the skills that, we should be looking for that are concerning if they're not present for a child of 9 months old. And it also has a little in-depth indication of what to do if the child is showing some signs of delay that you can share with the parents. So, as I mentioned before, the CDC Learn the Signs Act Early offered this free milestones checklist by age, starting at 2 months and going through 5 years. There's one for every age that's recommended for a well-child checkup. The list includes milestones across the 4 areas of the development, as we say, in the 4 domains. It also points out some important things to look for that could be cause of concern, like we call on the first webinar, the red flags, and tell you how to act early if you ever notice those things or if the child has not met those skills. Best of all, the milestone checklists are available, on the website and are completely free. You can print them, you can share them with the parents. They're, completely free for anyone to print. There's also other materials available. There's something that is called the Milestones Booklet. It's also on the CDC website. It's also available there are two ways you can get the booklet. You can order them for free with, a limited quantities, or you can print them and, create a Milestones booklet, right out of your printer and put it together. The Milestones Booklet, it's a comprehensive booklet that includes full Milestones checklist for all domains, like we discussed at the first webinar. It also covers ages 2 months through 5 years and matches all the recommended ages for well-child visits. There's also, they also have age-appropriate activities that are included that the parent can use at home to engage their children and encourage development for that specific age. There's also space in the back for the parents to record any questions or any concerns that they want to share with you at the next visit, or that they want to share with their pediatrician. So as I said before, you can print them, or you can request it for free at the CDC website. They come in many languages. They come in Spanish as well. One of the other things that we're going to talk towards the end is that you can customize these materials as well. So how can you use the Milestones Checklist? The Milestones Checklist, as I was saying, you can print a copy, you can take it with you, and you can print a blank copy for the families, so you can leave them. If you are in a home visiting program, you can leave them for them to check it later, or if you're in a program that you're seeing the families in your site, you can print one, and you can print one for you and review it together. You can recommend the families to put it on the refrigerator and to look at them once in a while to see what are the new things that their baby is doing. You can review the checklist, at every month visit if you have a home visiting program, or every 3 months if you review your treatment plans every 3 months. The way that at our program, the way that we use the Milestones the booklet is that we have one booklet for each child. We keep the booklet in our program. We review treatment plans every 3 months. So we pick up the booklet and we review the Milestones checklist with the parents every 3 months when we review their treatment plan. And it's so nice to see how much progress the children had made once the families complete the program with us. We give them the booklet so they can take it home with them, so they can continue monitoring their child's development. On the booklet, we customize it a little bit. We put the child's name, we put a picture of the child and the mom, so you can become creative with those, with different ideas to, make this also fun for the parents to want to do it. The CDC also offers a Milestones Tracker app, which is also completely free for download. And the Tracker app can be, downloaded in your phones, in your iPads. This is also another free material. This app can help parents and also you, the early child care educators, also to, track the child's milestones. It's also goal for ages 2 months to 5 years. You can use it on your smartphone, tablets, iPads. You can use the app to track the milestones of multiple children. The good thing about the app is that you can view photos or videos of each milestone. You can quickly reference milestones by age and category and find out what to do if there's ever a concern about the child's development. Also provides you with activities that the family can do with the child for that specific age, and it can provide you with updates if there's any new articles that have been published. Also, the app will pop you up with different articles about the importance of reading to children, or any of developmental articles that the CDC feels that are good resources for the parents. The app will also remind you about that. We also have a milestones brochure. The Milestones brochure provides parents with an introduction to the importance of monitoring early developmental milestones. It covers a few key milestones from ages 6 months to 4 years and provides information about what to do if parents are concerned about their child's development. I think that the design is very inviting and, parent-friendly. The brochure can help you communicate to parents that they are an important partner in monitoring their child's development and pride them for routine developmental screenings. I think that also the brochures are, a nice addition maybe to the waiting areas or any examination rooms. They're available in many languages as with other materials that are on the CDC. You can print them and you can photocopy them. Some ideas you can, maybe laminate it and have it in your bag if you're in a home visiting program, and you can always pull it out and, a refreshment of all the milestones will be right there. You can also post a link of the brochure on your center website. Okay, one of the most exciting materials that the CDC has are the age-appropriate books. This is one of my favorites. And as you can see, they have a series of 3 books for 1 year old, for 2 years old, and for 3 years old. Again, you can order them for a limited quantities, but you can also print them. What is nice about these books is that you can print them, you can put them together, but they can also be downloaded for free on iPads and phones and tablets. If we talk, for example, about the 2-year-old children's book, it's an engaging and interactive book that encourages children to help Tiger and his forest friends in their search to find bear. And every time you turn a page, children will get closer to finding bear, and the teachers, parents, childcare providers will learn about many important milestones to look for a 2-year-old child. If we go to the 3-year-old book, it's usually recommended from children from 2.5 through 4 years of age. And it also tells a story about Joey and all the things he can do now that he's 3. And throughout the story, Joyce goes through an amazing developmental milestones that, also teachers and parents can look at the bottom of almost every page. It's another great reminder, of all the amazing developmental milestones to look in children from 2.5 to 4 that are happening, and all the changes and, all the new things that are doing through this age period. The newest book that was recently released is for the 1-year-old, and it has the same format. It goes through, the journey of having a 1-year-old from 6 months up to 18 months, and all the things that baby, new skills that they are acquired, and all new skills that they are doing. So how to help families when there are concerns about development? So there are 5 points that I want to make on this slide, and then we'll talk a little bit about more on these. First, developmental monitoring to validate and pinpoint potential developmental concerns. So developmental monitoring is essential to help you with this. Conversations between the family and the child's doctor about developmental concerns. Developmental screening using a validated screening tool is conducted to determine if action is necessary. Next, there's going to be a referral to a specialist for establishing a diagnosis, and then referral to local early intervention systems to determine if the child is eligible for services. I know most of you are probably aware of this, how to refer for early intervention services. So we know that children from 0 to 3 should be referred for early intervention, the local early intervention system, and children who are 3 years or older, in order for them to receive services, should be referred in most of states to the Board of Education. Okay, how to talk to parents about their child's development. Okay, talking about child's development. parents see you as their trusted partner, and they look to you for information about their child's development. I know for a fact that celebrating milestones is really infectious. You know, during the first 5 years of life, there's a lot of firsts. The first mile, the first word, the first steps. And, you know, family begins to see the importance of those accomplishments and will want to take notice as well. Remember, the children go very quickly. You know, one day they're beginning to sit up, and then the next day they're running around the house. And those all small steps in between represent important developmental milestones like rolling over, sitting up, crawling, cruising, and walking. Just like these moments, milestones that are so familiar to parents, and as you know, we say on the webinar before, that child's social, emotional, communication, language, cognitive development all progress in a series of orderly steps. So in addition, there can be clues in those steps that could alert parents to a potential developmental concern. So it's important that you routinely talk with families about their child development, and the more you engage the family, the more they will engage. But it's also important to use good listening skills that can make conversation with parents easier and can help you feel more comfortable having this type of conversation. So sharing milestones with parents can help them have realistic expectations also and better understand their child's behaviors. If parents do not know when a child should have a certain skill, they may worry unnecessarily. For example, if a parent says she's concerned that her 2-month-old is not rolling over, you can reassure her that rolling over from tummy to the back is typically a milestone of a 4-month-old. When a child reaches a milestone early or late, it's also important to share that information with the parents. Parents always like to hear if their child has met a milestone early. For example, today, Jeannie built a tower of 5 blocks. That's a milestone we usually don't see until about 2 years old. So she's a little ahead. But, you know, we also have to have that, you know, not so fun conversation when we have to share information about a child that it's not progressing. And it's also important to give parents information about that as well. For example, Coffee is meeting lots of his 2-year-old milestones. I've seen him copy other children, and he points to things when I say them. And I know he knows names of parts of his body like ears, nose, and eyes. I haven't heard him say short sentences with 2 to 4 words yet. What are you seeing him do at home? And open up to that, you know, conversation with the parents. And what is important is to have good listening skills. Really help make conversation more successful. So using these skills will help build a relationship and encourage better communication. During the conversations, listen closely. Try to make eye contact, nod when appropriate, and be silent when the parent is speaking. After listening, repeat back in your own words the parent's main points, so he or she will know you heard and you understood. As you listen, also consider how the parent feels about what he or she is saying. Watch and listen closely for clues to those feelings. Developing and using these listening skills in your conversation with parents will help to enhance your relationship with parents and make difficult conversations more successful. For example, if a mother of a child in your care says that her child is not speaking as clearly as her neighbor's child of the same age, you might say, I hear you're saying, you do not hear Jeannie speaking clearly. If you acknowledge those feelings in what you say, you will build a stronger connection with the parent. For example, if a mother seems worried when talking about her child, you might say, it sounds like you're pretty worried about this. Monitoring development, how to encourage the parents, how to encourage the family. So Milestones Checklist and Milestones Movement Booklets from the CDC Learn, Design at Early program are easy to use. You know, proven tools are useful for family as they are going to be for you. So be sure to encourage the families to look into the websites and give them ideas on how they can use the materials. These materials can really help families understand what typical developmental milestones at a certain age and can help establish appropriate expectations. Not only with these materials, you give the parents a snapshot of what their child is doing right now, but they will also help them to anticipate developmental milestones that are emerging and what is coming next. So I think that, having milestone checklists as a reference can really help you, but can also help the parents think about, for example, what kind of activities they can plan, what kind of toys they may be appropriate, and how to create an environment that can really encourage this child's development. If you build developmental monitoring and feedback into, monthly home visits or into your treatment plans, then families will begin to notice what their child is accomplishing, and I'm sure they're going to begin monitor their child's developmental milestones at home. So having frequent conversations about development with the families can show the parents that you value their child and his or her development. How to communicate when you have a concern, and I think this is a difficult conversation to have. So before raising a concern with the family, make sure that you're well prepared. So beforehand, invest time in building a meaningful and collaborative relationship with the parents. Chances are that many parents already have some concerns of their own and might feel more comfortable having that conversation if they feel they have a relationship with you and it's built on mutual respect and open communication. I think that using the milestones is very useful, completing a milestone checklist for their child's age, either as a single sheet or in the Milestones Movement Booklet. If the child is between ages of the milestone checklist, use the checklist for the younger child. And then you can prepare for the conversation by reviewing some helpful tips for talking with parents about developmental concerns. And all these tips are also for free at the CDC website. So use the complete milestone checklist as the basis of your conversation. And okay, so we're going to go through some of examples on when talking to the parents about concerns. What are things that you should avoid, and what's the way that you should try to start this conversation? So avoid saying, I think Jason is behind in his development. He can't do things other children can do at this age. And try, I wanted to take a minute to talk with you about how well Jason is developing. I like to use a checklist for developmental milestones from the CDC and the American Academy of Pediatrics. It's good for helping us understand his development and which milestone he's met, along with which ones he's still working on. Using a checklist will help the parents understand that what you are saying is validated, and will help them also look in the checklist while you together as a partnership are doing. Focus on a specific developmental milestones in your conversation without including any diagnostic labels. So avoid saying, I saw a special on TV last week about autism and I'm pretty sure that's what Jason has. Instead, try, does Jason turn and look at you when you call his name? I have noticed that he does not seem to respond to his name, but continues to play with the track, spinning the wheels around and around. If you focus more on the developmental milestones and not giving a diagnosis, remember that when we use the checklist, we're not using the checklist to give a developmental diagnosis. We're using them to assess milestones and to help parents understand at what level their child are and what are the areas that the child has mastered and what are the areas that they may have not and they may need to get further assessment. Start off the conversation by highlighting some of the child's strengths. Avoid, Jason doesn't know what to do with a toy phone or even a spoon, and there are other milestones he hasn't met either. This list shows all the milestones he can't do. Instead, try. Jason has made some real progress in his developmental milestones lately. I notice he really likes to play alongside other children, and he's good at following simple instructions. There are other milestones he has met, and some he's still working on. Let's take a look at this list, and you can fill me in on whether you've seen some of these at home too. Be clear of what the conversation, be honest, kind, and respectful. Boys, look at all these milestones Jason is missing on this checklist. That means that something is really wrong with his development. He's way behind the other kids in this room. Instead, try, this checklist can help us better understand Jason's development. And that's what we're trying to do. But even if he's missing some of these milestones, that doesn't necessarily mean anything is wrong. It's always a good idea to pay attention to his development and to talk about it when you take him to the doctor. I'll give you a copy of this milestone checklist so you can take it with you and talk about it with his doctor the next time you go. Make a conversation a two-way discussion. So that's the list. Take it to the doctor and see what he has to say about it. That's what I wanted to cover today. Make it a two-way conversation. Try with open-ended questions. Have you seen Jason do some of these milestones at home? Pause. Give the parents some time, to look at the checklist. Now that you have looked at the checklist, what are your thoughts? And pause. Give a chance to the parents to talk about their concerns. What do you think is a good idea to do next? And pause. This is teamwork. It's not what we say is the best for them. Parents know their children the best. So we should be working as a team. We are here to provide them with the tools, and that's what we want to do. Other ways you can continue to support the families. Remember, providing support to parents to help them act early on developmental concerns may take a little extra effort, but can make a world of difference for the child and for the whole family. Remind parents that their questions and concerns are important, and that sharing them with the child's doctor is an important step to getting their child the early help he or she might need. There's also other resources, as I was saying before, on the CDC website, Learn the Sign, Act Early. So, for example, you can print a copy of a tip sheet called Concern About Development, How to Talk with the Doctor, and you can share that with the parents. This sheet includes the steps parents can take to prepare for their visit with the doctor, ways parents can ensure that all their questions and concerns are addressed, how parents can be sure they have understood what the doctor has told them and the next steps to take, and what parents can do if they feel uneasy about the advice the doctor has given them. Later, follow up with the parents to find out how the visit with the doctor went. If the parent is not satisfied with how the visit went or is feeling uneasy about what the doctor said, encourage the parents to consider getting a second opinion. Okay, today, I hope that these free materials help make, developmental monitoring and also talking with parents about early child development easier. To order the materials mentioned throughout all these presentations and more. As I said, there's a lot of other tips and sheets that you can use that, can make that difficult conversation easier for you. If you visit the cdc.gov/actearly, and you can look for the link that says free materials. As I was mentioning before, you can customize any of these materials with your organization's logo for, to get more information about that and how to print them locally and how to customize them with your organization logo. You can contact Early at cdc.gov. Okay, so remember, looking for milestones is important. There are free resources to help you, and you can help the families to serve. You can help the families you serve to help their children learn and grow, and acting early can make a real difference. So we have some time, so I'm going to look into the questions. Okay, so one of the questions is, how do you look under the CDC website? So just, you can Google learn the signs, act early CDC, and it will take you right there into the website. And then you have the checklist, you have the booklet, everything is in there for you to print, to download. There's also other resources for the parents and, for teachers, for early childhood care providers, and everything. It's on the website, and navigate the website. There's also there's also free learning activities that you can sign up for, and it's like a webinar that's constantly running. There's information about autism. There's also webinars about autism. So the next question is, how can you help to manage the development of a child if I didn't know the child before and the parents refuse to share information about the child? So, well, I think that, I think sometimes that's hard. I think that you have to be able to create a good bond with the family. Sometimes when the families have concerns about child development, it's very hard for them to open up, and it's hard for them to share their concerns. I think that, the more you talk about it and the more that you get that bond with the family will help them open up. I don't suggest that you start, talking about development the first time that you see the parents. You can definitely use the checklist and bring the checklist. If you feel that they're a little bit resistant, my recommendation is print the checklist for you and print the checklist for the family. You can tell them, you don't have to fill that, we don't have to fill this out together today. Why don't you take it home and we can have a conversation about this the next time you come. I would like for the both of us to fill this together maybe the next time they come, as I don't know your child that well, and you know your child the best. You are the one that can truly give me feedback of what your child is doing or not. I think it really makes a difference when you empower the parents, and we should be empowering the parents. They know their children much better than we do. So if we empower them, but if we give them the tools to do that, can make that conversation a little bit easier. So the next question says, this slideshow is on the website. So I'm going to let Evelyn answer that question, but yes, it's going to be on the website. I think it takes a couple of days for them to post it on the website, but yes, it's going to be on the website. Can teachers use Ages and Stages questionnaires without the training? I do not recommend for teachers to use the Ages and Stages questionnaire without training. The Ages and Stages questionnaire is a validated tool, and it needs to be administered, following the protocols. The training is very easy, and, as the more you do, the better you get at it. But I would strongly recommend for the teachers to get training before administering it. How would you encourage a parent to have her child evaluated when the parent themselves may have a developmental disability and not know? Yes, it's hard. I think it's also hard because sometimes parents who themselves have a developmental disability think that their child have a disability. It can be hard to understand because they had been through it, and if they didn't have a good experience with the system, it can be hard. But I think that the conversation should start by telling them that we're partners in this and that we're going to help them navigate the system and that we're going to support them, through the process of the evaluation, that we will help them understand what are the areas that, the child needs a little bit more support on. I also like to talk to parents about, how early intervention, what are the benefits that early intervention has, and that there's no side effects. When we recommend early intervention evaluations, when we recommend early intervention therapies, there's no side effects for this. We're really creating an environment where the child can thrive, and that's what I usually use in that communication. And maybe opening up to the parent why they're concerned about, the child being evaluated, what are the things that are scaring for them, and maybe understanding that they may, as a person with a disability may not have had the best experience, and how we can, work on, addressing those fears. Where can we get the training for Ages and Stages? Ages and Stages have their website. If you also Google Ages and Stages questionnaire, they will give you all the information about it. I think they do trainings, in-person trainings. I'm not sure if they do online trainings. I do know about the in-person trainings. So if you look into the website, you can get the information. Do we receive a certificate once we complete this webinar? Okay, so I think that question has been answered. We do not offer certificates. So I don't know if there's any more questions. So any other questions? Okay, so Evelyn, you want to take over?
Yes, thank you. So I just wanted to thank Dr. Barros for today and for a wonderful webinar. And I want to let people know that these are both posted on our website under past events. And in a few days, you'll have this webinar as well. So thank you.
Okay, thank you so much, everyone.
Thank you. Take care. Bye-bye.